Hi there. Good day to everyone. Good morning, good afternoon, and good evening. Thank you so much for joining us today. And thank you for the little Mary J. Blige to get us started. I'm Ginger Zielinksie. I'm Chief Strategy Officer at data.org, and we're so thrilled to be able to host this conversation. As you may know, data.org is a platform for partnerships to build the field of data science for social impact. And our conversation today could not be more poignant. Today, we look forward to exploring the topic of gender and data, specifically honing in on where there are gaps and bias in the many types of data, the impact that these gaps have on all of our lives, and what together we can do about it. Before we get started, I want to give a little shout out to author Caroline Criado Perez, who wrote the insightful and inspirational book, Invisible Women, Data Bias in a World Designed for Men. If you haven't taken a look at this book, I really encourage you to do so, as it was especially illuminating regarding our topic. As we prepared for today's conversation, what struck me most was the compounding impact that these gender-based data gaps perpetuate, not just for individuals, but for families, for neighborhoods, and for communities. Further, I was struck by its pervasive reach. These gaps influence issues across the board, related to everything from urban planning, economic development, healthcare, and more. Finally, these gender-based data gaps influence a woman across her lifespan, from birth through old age. So, with that as our backdrop, what we wanted to do today was first get started with a poll and get all of your brain waves engaged and flowing. So I'll ask us to start the poll, and what the question is, what problems disproportionately affecting women do you feel are most overlooked? We'll take a couple of minutes as you fill out the poll, and then we'll begin by hearing from our panelists. Just a couple more minutes or a couple more seconds, I guess. Okay. So we had 51% affecting healthcare, 38% voted for income, 40% safety, and 23% environmental. I'm not surprised that what this really shows us from all of our attendees is that, and just like I was mentioning, is both its compounding impact and its pervasiveness. And so that certainly reiterates that point. And thank you so much for sharing your perspective. And now it is my great honor, I cannot understate or overstate that enough, to introduce the panelists that we have with us today. Just by way of our agenda, what we'll do is I'll ask a couple of foundational questions, and each panelist will then have an opportunity to answer them. We'll go around in 2 sessions. Then we'll open it up for a conversation amongst these fantastic women. And then the last 20 minutes, what we'll work to do is engage in a dynamic Q&A. So please, if you do have questions, you can start by posting them right in the Q&A box on your Zoom screen. And as was mentioned in the beginning, please do let us know and introduce yourself, and we look forward to engaging in this important dialogue. Our panelists today, I'll start with Ramsey Alwin, who is the CEO of the National Council on Aging. Also with us today, we have Dr. Marianne Etiebet, Executive Director of Merck for Mothers, Swetha Kolluri, Head of Experimentation at UNDP India, and Jackie Mwaniki, Energy Sector Leader for Fraym. Thank you all so much, most importantly for your work and also for joining us today. My first question will be for Ramsey. Ramsey, you've spearheaded data-driven policy change to fight for better services for older, low-income people, and specifically women across your career. How has data and data science informed your policy work?
Well, Ginger, thanks so much for having me and the National Council on Aging participate in this important, timely conversation. I've committed my life's work to ensuring the economic security of individuals that are vulnerable, and women absolutely are at the forefront of that. When you think about the lifetime of disadvantage that compounds on old age, you think about occupational segregation into low-wage work. You think about the lifetime spent caring for others, younger family members, children, as well as older, frailer family members. A lifetime of low wages, occupational segregation into low wage work, compounded with caregiving years, 7 years on average without wages, illustrates that there are so many challenges that then add up to aging into poverty. And so at the National Council on Aging, we are committed to improving the lives of millions of older adults, especially those struggling, using a very data-driven, metrics-based approach to identifying who needs our support most. And we've committed to improving the lives of 40 million older adults by 2030, with 60% of which being women, because so many older women age into poverty. And unfortunately, that story often goes untold.
Ramsey, I know that this has been a lifelong passion and really fight for you. I'm curious, as we've seen this evolution of data in terms of how we make the case, fight for policy change, and serve older adults, how are there specific data or data science tools that you've been using or that you've developed or created that have really helped arm you with more resources as you continue your fight?
Absolutely. When you think about how policy is determined, how resources are allocated, so much of it depends on the use of the federal poverty measure in the United States, a measure that was created back in the 60s based on the most recent census data, a tool that was designed with the assumption that 1/3 of your budget was food. And needless to say, only modest cost of living adjustments have happened since that initial methodology was created. However, that federal poverty measure guides the allocation of so many supports and resources across our states. When I was at Wider Opportunities for Women, I took a deeper look at the true needs of making ends meet in old age. And we designed the Elder Economic Security Standard, a more modern look at the true costs of healthcare, of housing, of transportation, and all the basic needs you need to age in place. With our analysis, the Elder Economic Security Standard virtually doubled the amount of elder poverty across the country. I worked with Congress to introduce the Measuring American Poverty Act to revise the federal poverty guideline to be a more realistic measure. At the point in which the Obama administration took the helm and we had a more favorable policy environment, the census adopted a supplemental poverty measure that better tells that true cost of living story. But today we're still woefully undercounting those that at the end of life plummet into poverty because of a lifetime of disadvantage, and that's mostly women. The Elder Index demonstrates 60% of Black, African American, and Latino women age into insecurity. And our current tools that the federal government uses to allocate resources and provide supports only scratch the surface of that need. So there's really an important opportunity to build on the existing tools and have better data and better metrics to do the planning and designing and allocation of resources to help individuals age well.
Thank you so much. Jackie, next I'd like to turn to you. If you could just share with us, what unseen problems have you dedicated your life to shining on through the lens of gender?
I'd like to pick three, and those are very close to me, close to my heart. So the first one I'd like to pick is food insecurity. It's an issue that's intertwined and interwoven with so many other ripple effects. So we see in other areas, it might be food insecurity, but it affects healthcare, it affects safety, economic empowerment of these women. And I feel like this is one that continues to affect women directly in person, but the ripple effect is felt to the community. The second one that I would like to shine a light on actually is looking at child marriages. If you didn't know, 650 women and children get married off before they're of age, which means these are women who are married off before the age of 18. It might not look like it's such a rampant problem, but when you follow the lives of these women, you realize that their lives are, through their lives, they will be limited to access to education, to economic empowerment, to financial inclusion. And also, it also increases their exposure to violence, not just gender-based violence, but generally violence in particular. And the third one is energy poverty. And I'm looking forward to sharing a lot more on this, because energy poverty, again, it might be looking at the women, and the woman essentially is a seat of the power when it comes to deciding the source of energy at the household level. But again, it affects so many aspects of her life, in addition to just the kind of energy that she uses. It affects her education, her children's education, the education of the household literacy levels, her financial inclusion, and many other aspects that I look forward to digging into.
And Jackie, just a follow-up question on that, because I know your work at Fraym and with your partners at Solar Sister. I'm just curious if you could share a little bit more about how your team and your partners are using data science to further uncover and develop solutions specifically related to energy poverty.
This is the first time that we have worked directly with an organization targeting women entrepreneurs and women who want to sell to women, essentially giving the power of decision-making around energy from woman to woman, creating a community based on the seat of the decision-making. What was interesting for this particular project and very close to me was they wanted to find households headed by women. They wanted to identify the age of these women, know more about these women. Are they educated? Are they financially included? And finding pockets of communities that have majority of these women and mapping them across a country. We'll be looking at Nigeria and Tanzania, but also looking at women-led communities, not only in these two countries, but finding them across Africa. And this is going to be interesting because we will start to see how similar, yet how different these communities are, but based on the same characteristics. It's the first time that we're thinking about energy going through the model of Mary Kay, where women are selling cosmetics, but now we're thinking about a more technical product, which is energy and has a more ripple effect, not only on the women, but also on the community and the general SDG 7 achievements.
Talk about power.
Yes.
Next up, I'd like to turn to Marianne. Marianne, we've heard from Ramsey talking about older adults and Jackie talking about women as entrepreneurs. And I'd love to switch gears and talk to you about women as mothers and the work that you have been able to conduct and oversee. So please share with us a little bit more about how you have used data and data science in supporting moms across the globe.
Thank you so much, Ginger. And I was struck with something you said earlier about how is it that we value women? And Ramsey, talked also, about the ripple effect of that devaluing women over a lifetime. Mahmoud Fatala, has a saying, women are not dying because of diseases we cannot treat. They are dying because societies have yet to make the decision that their lives are worth saving. And every day, over 800 women are dying due to preventable complications of pregnancy and childbirth. And these women are, most of them, uncounted, unseen, and unknown. And even in the United States, where we think of us living in a technologically advanced and high income nation, the mortality rates have been rising in the last 20 years. And Black women are 2 to 3 times more likely than white women to die from preventable maternal causes. So we're seeing that maternal mortality exists in that nexus of both gender and inequality as well as racial inequality. It's not just a vital sign of our health system, it's a vital sign of our society. And so when Merck for Mothers was created back in 2011, We are working to shine a light on this issue to ensure that no woman has to die while giving life. And one of our core pillars, as you mentioned, is around evidence generation. When we started, there really wasn't a broad awareness of this issue in the US. There was a lot of uncertainty around the data. And we worked with organizations like the CDC and CDC Foundation to support states to count every death. And not just count them, but investigate why women were dying. That resulted in that first multi-state report. And it's this data that's pushing people to action and has resulted in legislation that's supporting these committees in multiple states. So whereas about 10 years ago, only about 21 states were counting deaths, now it's above 45.
That's just so stunning to me. And I've repeated that statistic in several settings since you've told me the fact that, still not all states in the United States are counting maternal deaths.
Yes.
I mean, to let that sink in for a second is it's jaw dropping, and also it emboldens me. Right. So I just think we've got some work to do.
Yes.
So first, thank you for everything that you and Merck for Mothers has done. And, I want to dive in a couple minutes as to well, what's next? Because certainly this battle is not yet over.
Thank you, Ginger.
Thank you. And then Swetha, I'd love to turn to you again. Would love for you just to share with us the work that you're doing and how you, what unseen problem have you committed your professional life to shining a light on through the lens of gender?
Yep. Thank you, Ginger. Thank you for inviting me to this webinar with this fascinating women leaders in data science. I would like to pick up a couple of areas where I have applied gendered lens. One of them being poverty eradication, and the second one being women entrepreneurship, especially dealing with the collectives of women. So I've been working with various governments and civil society organizations in India for about a decade, and designed several digital initiatives to address poverty eradication programs. Especially those that are, involved in promoting self-reliance efforts of rural women through institutions like self-help groups and cooperatives. Some of the questions that I have been chasing were how do we reach the development programs to the more vulnerable populations? How do we make programs more and more proactive by design for inclusion of the vulnerable women like single mothers, widows, women from the lower caste, because the caste system is rampant in India, particularly vulnerable tribal groups, and women in bondage as well. That means women who have taken debt and hence got into some sort of a bondage with the debtor. While trying various strategies to reach the programs to women and reach them proactively to women, how can we objectively measure if we are able to make a difference or not? So these are some of the questions that I have been, pondering over and trying to address in the past few years. After joining UNDP, these days, I have started focusing more into the aspects of systemic bias that restrict freedom and opportunities of women from undetected quarters, such as bias in criteria, rules, bias in metadata, and even training data in the era of artificial intelligence. So these days, it is more about systemic bias that I'm keenly looking after. Thank you.
Swetha, I'd love to dig in a little bit further as you talked about the populations in which you're most interested on and poverty eradication, specifically in rural India. I imagine that data collection is a big part of the challenge. Have there been specific strategies that have been more effective in gaining access to that information and uncovering reliable data?
Yeah, definitely. So there have been, quite a lot of challenges in developing these digital initiatives. Collecting data, especially from rural areas and from remote locations, is not a very easy task. But as technology has started progressing, now we are tapping into various forms of alternative data as well, which are not necessarily, the survey based. to look into those geographies and pockets which seem to be more vulnerable than the others. So there is a lot of interesting, development with new technologies, especially with a lot of cloud computing, with improvements in the artificial intelligence and machine learning algorithms. We're able to cull out a lot more intelligence than what we used to do 10 years back. So things have, progressed significantly.
Excellent, thank you. And thank you all for that wonderful introduction to your work. We're going to dig into a couple of topics that were very resonant when we were able to prepare for this conversation. Ramsey, I'd like to start with you and hone in a little bit more around the concept of unpaid work and caregiving. Obviously, this has multiple effects, and just curious your thoughts on how you've looked to better understand the power of unpaid work and its influence on economic vitality or economic insecurity over time. And if you can, maybe, and then even a further anecdote as it relates to the impact within COVID.
Sure. Well, in the United States, I mean, so much of our social contract is built on an assumption of a household in which at least one individual takes on the caregiving of the children and of the elders. And we've never evolved that social contract to better meet today's contemporary realities. However, according to the latest analysis, there are over 53 million caregivers in the United States. 1 in 4 of those caregivers is a millennial. Disproportionately, those caregivers are women, and it's billions of dollars of unpaid work that is ensuring our economy and our society is achieving its goals, yet it's on the backs of women. And we have not yet updated various programs to reflect that. Just as an example, the Social Security program, a vital social insurance program in the United States for individuals in old age. It does not account, it does not credit a woman or a man for that matter, those years that end up being zeros on their earning records, while on average, the woman is spending at least 7 years providing care for a loved one. And so that catches up to her and it pulls down her overall earnings over a lifetime. And so women on average are getting far less in Social Security than men. At least a quarter to a third less than men experience. And then on top of it, they're living longer. In living longer, and they're having more out-of-pocket healthcare costs over that longer life expectancy, that health span. As a result, they're finding that they're coming up short. No fault of their own. It's just virtually impossible to make ends meet. So at the National Council on Aging, we've adopted and we've embraced alternative measures of economic security to better understand the true needs of making ends meet. And we've worked to align our programmatic goals to an outcome of achieving economic security. So as we work with community-based partners across the country to help individuals enroll in benefits, public and private assistance programs that can help with the cost of medicine, food, and utilities, we're always striving to help nestle in those programs to get a woman closer to a level of economic security. So in addition to having the right data, it's then using a data-driven approach to measure outcomes, because the metrics matter and what gets measured is what gets done. And so we take a very evidence-based, data-driven approach to our programmatic offerings.
Thank you. Marianne, similarly, when you mentioned how mortality rates are more pervasive for Black and Latina moms. I'm curious how you are thinking about how does that turn into, how do we turn course there? Like what systemic change, how are you using then that data to spark policy change, and what successes have you seen in those efforts? Oh, you're on mute.
Thank you. Great question. And I think, one of the things we've learned is not just what the root causes of maternal mortality are, but we've also learned a lot from the process, and it's also about how gender bias and inequality actually limits our understanding, of the multiplicity of factors that are driving maternal deaths. And I'll give you just, really concrete example. I mentioned deaths are investigated by these maternal mortality review committees. Historically, these were manned, and I use that term deliberately. They were manned by specialist physicians, traditionally, all men. And so we've worked to make sure that these committees actually reflect people who are interfacing with women throughout their pregnancy and childbirth journey, including folks from the communities, and include the folks who are most impacted by maternal mortality. Also ask folks to investigate near deaths, so the women who are affected can actually share their perspectives. And when that happens, the root causes change and also opens up a whole new area of opportunities for action and prevention, of the next death. So I think that, how we use data and data science, is so important. And I think our field also, when you look on the global stage, is a little bit stuck in old traditional methods. I would love to see these data science innovations being applied to maternal mortality, because as I mentioned before, it's not just one cause, so we're not trying to prove this intervention works, this intervention doesn't work. We need to understand patterns and dependencies and interconnectedness, of all of these factors in order to really get a full picture of what's driving maternal mortality.
Thank you. I appreciate you raising the consideration of participatory design and thinking about how we're engaging women at all stages of the intervention, right? So not just better understanding the problem, but better also than architecting solutions. Jackie, I'd love to learn from you how you're thinking about participatory design in the work that you're doing as you're exploring the clean energy work with Solar Sister.
So one of the things that we are looking forward to digging into is publicly available data sources. One of the things that we've noticed in our journey in terms of the data and the data science tools that we use is a lot of data has been collected historically. This data continues to be important because we need to look back historically at what the trends in these communities are, what are the prevalence of certain issues, and looking at the data sets that we provide. We're looking at, first of all, data sets that are collected by very credible agencies. So for example, we're looking at the demographic health surveys that is done by the USAID. They're done at national level. They're very robust. They ask a lot of questions. And what is powerful about these data sets is we're able to understand sex aggregation. So being able to look at, is this a male or a female headed household? What is the composition of the gender in the household in general? What is the age of the household members? What is the employment? What is the access to energy, access to financial inclusion? And this being a household survey, we are able to collect this data inside the household. Now that's one data point that we're pulling or bringing to the table. A second one that is very important is because we are a geospatial data company, we also want to help organizations understand, like Solar Sister wants to know where in Nigeria are these respondents residing, where do they live, where are these communities based that we're collecting this data from. So being able to just partially enable this large data sets, we're able to understand what communities in different parts of a country look like. And then the third component is testing for this household that we're looking at. This is where they're located. What is the access to things like electricity grid? What is the planned grid? What does a planned grid look like? What is the access to energy going to look like in the next 5 to 10 years? And what are the best programs to roll out for these communities? So being able to bring a very holistic 360 view of a community allows us to not only target just one aspect, like for example, energy poverty, but we can also tackle gender inequality and then also project what gender inequality, what this balance or like addressing this gender equality will have a ripple effect in education, healthcare, for example, for all the members of the community. So I think what is missing, or rather what we're seeing, is there's more acceptance to looking at existing data, and we're willing to look at it from a gender lens. Now we want to see this data that is existing, what does it say about the gender discrepancy for the different communities? And how can we get actively involved in addressing these issues? That is very community specific.
It's interesting because as you were sharing those reflections, it's like, first we have to correct the inaccuracies of the past and the gaps of the past. And then we have to better plan for, you know, today. And then how do we think about building more inclusive models, more inclusive data sets for the future, right? So that we can actually correct and move towards a more equal society. Swetha, I'm curious, you know, you mentioned the metadata in which you are working with. Are there specific ethical considerations that you really need to hone in as you're using those large data sets, as you're engaging in more of that deep learning?
Yeah, definitely, Ginger. So the ethical considerations are, you know, very, very important, especially when you are looking into these large data sets and applying algorithms on them and, bringing out these insights. Because you often come with very sharp insights, which, invade into someone's privacy, and you can run into a lot of trouble with that. So ethical considerations, what we see is, usually you apply a lot of anonymization and tokenization techniques in order to ensure that the data is anonymized. And for instance, if you are doing a survey and doing a primary research, definitely consent is very, very important. That is at the forefront. So there are a large number of, the ethical guidelines as well as data privacy laws that you need to follow while you are treating this data. So yes, definitely a lot of ethical considerations are there. So yeah, whenever, even when we partner with other technology agencies, we do consider these aspects.
Thank you. I want to ground us in the present for a moment. It's impossible for us to have any conversation that doesn't explore the ramifications and how much this is exacerbated within the context of COVID. So no matter if we're talking about racial disparities and inequalities, unpaid work, the complications of moms as entrepreneurs and heads of households and teachers, all of those things just have such magnanimity in terms of a woman's day. I'm curious if there are specific reflections or opportunities that have been uncovered or, further exacerbated in your work as it relates to the context of COVID. Swetha, would you like to start?
Oh, yeah, sure. Of course, no conversation is complete these days without the discussion around COVID. So in most of our development discussions, there's a phase before COVID and then after COVID, during COVID and after COVID. So these are the three phases we keep discussing. Let me just touch upon a little bit of, the long-term development trends before I get into the COVID aspects in India. So if you look at some of the development trends, especially on, gender equality, even before pandemic, there have been some parameters which have been worsening over time. This is especially in India with respect to the female labor force participation rate. Usually what you see is as we progress as a nation, the GDP is increasing. There are several things that are going positive. You don't expect that your female labor force participation comes down. So this is what we have seen in India. In 1990s, it was about 30%, and now it has fallen to 20%. And this fall has been very, very steep in rural areas, and it is very alarming. Now, with COVID, what we are seeing is this gender inequality is increasing further. Especially in the sectors in which women's participation is higher. For example, there are about 70% of workers in apparel industry that are women in India. 70% of weavers are women. Yeah. And 70% of farm labor are women too, but they're often found
Wow.
in disguised unemployment. So you don't sometimes, miss on these numbers.
I would have really gotten
All,
that question wrong. I did not realize that it was so high. I mean, those are powerful statistics.
yep. And all these sectors were severely impacted by COVID. In fact, even globally, you see that several female-dominated sectors were severely impacted by the pandemic. So during pandemic in India, women had to spend like 30% more time on family responsibilities, unpaid care work, and even on the domestic violence front, we could see a clear spike during the pandemic. Um, what we are also seeing is on digital front, we are seeing many consumers, businesses, they have been adopting digital modes and digital ways of working, and they have switched very quickly during the pandemic. And why not when there are 600 million users of smartphones in the country, and the internet is very, very cheap. It is less than $0.3 per gigabytes of data, which is pretty cheap when compared to US or any other European nation. Now, while this digital transition is an important development in the country, it has not been equitable. Less than 33% of rural women have never have only used internet just once, as compared to 62% of men in the country, which means 2/3 of the women have not been on internet ever. So you can imagine how huge the opportunity divide was during the pandemic when everything was going digital. You were talking about agri-tech, food tech, fintech, edutech, right? Everything tech.
Yes, any
But
type of tech.
yes, and you see so many of these women really left out of the tech generation.
Yeah,
So the digital gender gap is very huge, and it is raising very fast, not only in India, but also in various other parts of South Asia. So during the pandemic, well, of course, as UNDP, we have also ramped up our efforts on digital literacy front, on digital financial literacy front, because you got to make payments online, and you got to participate actively on the e-commerce to earn your livelihood. So we have done that, especially for weavers and artisans, and the returns were very good in terms of development returns. But however, we need many such initiatives to address this very fast-growing problem of gender divide, and we need to do them at pan-India scale. So yeah, so this is what we have seen during the pandemic.
Well, it's so interesting that we started the question around COVID, and then it went to the digital divide, and then just further exemplified, like, it seems that no matter what problem we want to tackle or to discuss, then it's only then further segregated by gender. I want to stay there's been a couple questions as it relates to the impact of COVID on all of our work, and as I look across the screen, I imagine that you very much so I'd just like to stay within that context for a second as I think about new moms, older adults, women to try to be becoming entrepreneurs. We can imagine the challenges. Marianne, starting with you, how has COVID changed your work, and has it created opportunity? I mean, sure it's created both challenges and opportunities.
Yeah, I think our experience at Merck for Mothers really has been being led, by our collaborators on the front line. And they have been so amazing in their ability to pivot and be responsive, to the challenges that COVID has created. Their commitment to still ensure that they are touching clients, touching patients, has been amazing. And what we've tried to do is, figure out how we can support that. And I know we started talking about digital, and that has been, a key mechanism. And so I don't think we can underestimate the impact of the digital divide in how we think about the future of healthcare. I'll share one platform that our partners use in Kenya to share information on family planning services. Even before COVID, about 25% of the people who were accessing that information were men. And in India, it's up to 60%. Some of that, is because of the skewed access to digital technology. But I think also knowing that, men are wanting to access this type of information, kind of blew my mind, because that's really not how we have been approaching, helping to close the gap around full access to modern contraception. And so our partners need that capability building, need that investment in digital infrastructure in order for them to reach their clients and patients. And I think that from a health perspective and from the health sector, as we think about building back post-COVID, as we think about which are the sectors that actually people are investing in, it is tech. How can we be intentional and deliberate, create the policies, create the incentives, so that those investments can actually have the positive ripple effect on health? Because I think that in this time where there are such constrained resources, we're not going to be able to access, separate resource streams for this issue or that issue. We're going to really have to piggyback on the investments that are happening in technology and making sure they're closing the gender divide and making sure that they are being applied to other social impact goals.
Thank you. Thank you so much. I'm going to spin the conversation. There's several questions that I want to make sure that we get to. And Ramsey, I'd like to shape the first one to you. I have, as some of you may know, I've had some experience in the field of supporting older adults. And so I know that both the what we've called the gray tsunami, right? The amount of older adults that are aging in the United States and across the globe is almost a doubling that we'll see in the next 20 or 30 years. And obviously there are market incentives. And then we also, I imagine that you could talk at great length about the digital divide as it relates to low-income older adults, and only further exacerbated in developing countries. I'm curious what recommendations or suggestions you have for our private sector partners as we think about these historical gaps in the data as it relates to gender and the opportunities in front of us. What would you ask from your colleagues in big tech?
Sure. Well, there's an incredible opportunity. In the US alone, over 71 million baby boomers, 10,000 of which are turning 65 a day. You've got 90 million millennials that'll live to be at least 100 years old. So first and foremost is get familiar with the demographics and really anchor your understanding on the market opportunity.
Better get a sense of the data, huh?
That's right. There's a $7.6 trillion economic ripple effect of the 50 pluses buying power, vast majority of which are women who are in the position of chief financial officer, chief medical officer. She is overseeing the household. Put her at the center of your design and your thinking. She's taking care of mom and dad's needs, her kids' needs. She is not risk adverse. She is thinking about a variety of goals she's trying to achieve in terms of meeting her needs and her family's needs. So first and foremost, your workforce has to reflect this demographic of aging and of gender. So you're tuned in on what her needs may be. And in terms of the private sector, I think there's an incredible opportunity. The Sustainable Development Goals only until recently did not count women after the childbearing years. According to some incredible advocacy by Erica Dar, who's at the UN, and her counterpart Amal, we now have aging and life course included in 15 of the 17 Sustainable Development Goals. Previous to that, women over 40 were not being counted. If you're not getting counted, then how can any of the interventions, any of the sustainability approaches meet your needs, your lived experience and your needs as you age? So get steeped in the Sustainable Development Goals new edition of Aging and Life Course and what that means for your operations and ways that you can integrate a life course perspective, thinking about your consumer through her many life points she experiences and how you can better meet her needs to ensure her resilience, her family's resilience, and her community's resilience.
Again, it's just so stunning. You all say these statistics and it's kind of like you hear them and then you actually stop and think about them, the fact that women were not counted after the age of 40, like that is, it's just unacceptable, right? So I think one lesson that we all have to carry from this webinar is first, we have to demand that the data reflect the totality of our communities, right? That we all have to be those warriors in the fight for data equality, and that's step one. The fact that maternal deaths weren't being counted, women over 40 aren't being counted. It's just so mind blowing. And again, I hope emboldening to us all. There are several questions that I want to make sure that we get to. I'm gonna open this up to all of you. I'd be curious your responses. The book that we discussed, Invisible Women, I'm shorting the title, really broke through and garnered a lot of media attention. And we're curious, how do we keep this, knowing that these problems are so pervasive, how do we keep this front and center? Jackie, let's start with you. I'll put you on the hot seat.
I think, first of all, it's acknowledging that one of the themes that I keep hearing is what gets measured gets done. Creating surveys that help capture women and the issues affecting women continues to be one of the requirements for the world to move forward. Understanding what these women look like, what they need now, what they need as a girl child, what they need as working women and as they age, as we continue to talk about this, and looking at the perspectives of different sectors, really, energy, healthcare, environment, economic empowerment. I think these themes will continue to ride on how much data we have about the women that we are counting. And I think data is available. We've started to see a lot of interest in sex aggregated data sets, like tell me what the women look like. And I think that interest is exciting. We are working with partners who are drilling down or supporting causes around women-driven work or women-driven impact work. And I think those will continue to be stories for the early adopters who are excited, but also to encourage others to join the train in achieving gender equality.
Would anyone else like to address that question, Marianne? Thank you.
Sure. No, Ginger, I can. I think it's this marrying of the stories, the personal stories that pull you in, and the data that pushes everyone to action. I grew up in Nigeria. It's a culture that values boy children over girl children. And people would say, oh, it's just a preference. What's the harm? But we know what the harm is. That those preferences result in practices that not only perpetuate gender inequity, but when I first heard the statistic that because of that preference, 140 million females were missing from the face of this earth. They were not just invisible, but they've been erased. That changed how I thought about everything. And I think it's these really startling data points that people cannot refute, that people cannot ignore, that really allow us to mobilize action around these issues. So I don't think that we can let up the pressure on getting these data points and making sure that we are sharing them with the folks that can actually make decisions. And related to that, we need to make sure that the folks that make decisions are actually broadly representative of society, because even in the healthcare space, 70% of healthcare workers are female, but about 70% of the global health organizations are led by men. And I think data sometimes can be understood in a theoretical sense, but we know that oftentimes decisions are made based on whether folks can relate to the issue, and a lot of that is unconscious.
Ramsey, I'm curious your thoughts. I am very astute to the fact that while our older adults are aging at a rapid rate, only 2% of philanthropy goes to services and supports for the elderly. How are you working to combine, thank you, Marianne, the stories with the data? And are there certain ways in which we can be thoughtful and more aggressive about both policy change and public perception?
Sure. Well, I wholeheartedly agree with Marianne. We need the qualitative and we need the quantitative, and we need to tell the story. We need the women in the boardrooms, in the leadership position, because the conversation changes, things are designed differently. And at the National Council on Aging, this pandemic has just been brutal. We have tried to shine a spotlight on the fact that 80% of deaths from COVID have been people 65 and older, a third in nursing homes. Nursing homes disproportionately are women, communities of color, and we're really using this unfortunate crisis of a pandemic to shine a light on aging as a social justice issue that it is. The quality of years, the quantity of years, everyone should have the opportunity to age well, and disproportionately women are the ones aging into poverty. So we are bringing those stories to the halls of Congress. We are raising up the data, qualitative and quantitative. However, we need more. In particular, we need the cross-tabulation. We need to be able to tell a better story in terms of the intersection of race and ethnicity with age, with gender, with sexual orientation, because that's often where the rubber meets the road on this cumulative disadvantage over a lifetime. And we all need to be elevating those stories and articulating the systemic failures, the lack of access to some of the social determinants of health that put a person at 60 and 65 far behind the curve and much more vulnerable to pandemics like COVID-19.
And so there's a question from an individual who says, like, what can we do as both producers and consumers of data? Like, how do we, from a citizen activist perspective, how do we encourage that this type of gender data, going back to kind of one of our founding challenges, is better collected? What can we all do about that?
Well, personally, I think we can demand it, and we can demand more transparency in the use of the existing data sets, because first and foremost, more transparency with the existing data will then call out what's not yet being collected, so that we can all then begin to demand that we add additional dimensions to our analysis.
If I could add, Ginger and Ramsey, I think from a collective action community perspective, it's also about that inclusion, making sure everybody's voice counts and is included. And I think, that's really what, these grassroots movements can ensure. And I think that there was a question in the chat, exactly about that. We need to make sure that we are as inclusive as we can be as we think about the data.
Jackie or Swetha, any additional thoughts before I jump to our last speed round?
I think for organizations like Fraym, embracing this data and also making a lot of data available, breaking data silos, I think allows the use of more gender aggregated data, right? So encouraging organizations based on the fact that there is data that exists, there's data to fix the problem that you're trying to address. Remains what is key for us at Fraym.
Thank you. Swetha, were you going to jump in?
Yeah, sure. I actually agree with all the panelists. Just one more dimension to this. As a citizen, I think there's a lot of merit even in the citizen science data, because several times, data sets are not available, or they're not validated, or they're not transparently available, or certain vulnerable groups are not represented appropriately. So in which context, I think citizen science is also a very, very powerful tool. So if you are a citizen science activist, then it would be wonderful to have this sort of a data coming from a large number of citizens in a very, very structured way. And there are some very interesting platforms where the citizen science scientists can actually, enroll and contribute as well.
Thank you. And as promised to my colleagues, I promised that we would end with a so what. as we all think about this, us being a global community and a platform for partnerships. It can be something that we already said. You guys shared a lot of solutions, but in the last minute or two, Ramsey, so what? So what should we all be doing?
So join us at the National Council on Aging in elevating the injustices of individuals that don't get the opportunity to age well with the health and economic security they desire. So visit ncoa.org, learn more about our policy advocacy work, and get a loved one, an older loved one, connected to the many resources we have available to help improve their health and economic security. Thanks so much for having us, Ginger.
Oh, it is my absolute pleasure. Jackie, how about you?
I would say use data. Find ways to execute data-driven programs. There's a lot of data that exists. Find organizations that can help you address or find the right insights that guide your programs, but also continue to collect data, because it's the data that keeps the story going. It's the data that shows where impact has been met or where impact has been achieved. And I think as we continue to get into a more technical world, we're every day producing data, but can we also use this data in a way that moves the SDG goals farther ahead?
Thank you. And to Swetha?
Well, to me, I think the future is going to be tricky, especially in terms of the bias entering the data sets, and it's going to become more fuzzy and more tricky. So I would encourage a large number of professionals to join this intersection of data science and social science. Yes. Something like computational social science. We need a lot of multidisciplinary professionals. Yes. To come up with this special lens, and especially women. Right now, yes, there are less than 1/5 of data scientists are only women. So we need many more women to join this sort of a movement and apply the lens, a trained lens, to see where things are going wrong, to identify bias, which is coming in more and more complex ways in the near future.
Absolutely, thank you. And Marianne, closing us out.
So two things. One, as individuals, we all can have a role to play in saving a mother's life, but also as representative of organizations and institutions, we also all have a role. We should get away from silos. We should be sharing data sets. We should be thinking about expansive, creative solutions, to these issues, and work together to combine data and understand the patterns that they're telling us.
Well, thank you. Thank you all so much for your work and for joining us and for sharing your insights and your expertise and your perspectives. Like I started out, it is my true honor to be able to host you all together, and look forward to future conversations. And to all of our panelists, or all of our participants, thank you so much for joining us, and encourage your daughters, your sisters, your moms to get involved and to understand, your aunts, your aunties, to really understand the power of data and data science to improve women's lives across the globe. Thank you so much, and have a wonderful rest of your day.